I'm Dr. Carine of PurelyIntegrative.com. Today, as this season changes, we're going to talk about the very important topic of vitamin D. Vitamin D is a little bit misunderstood. First of all, we call it a vitamin when it's really a hormone. And like most people know, hormones have really wide-reaching effects on our body, from thyroid to estrogen to testosterone. And all of us know that those things can cause a lot of different changes in our body. Vitamin D is the same way. So now as we understand vitamin D and its more complexity of the way it works in our body, we recognize that it's very important for mood and affected with seasonal affective disorder. Vitamin D helps regulate our immune system, so we know that patients who have low vitamin D in the winter are more likely to be hospitalized and die from pneumonia and asthma and other inflammatory related diseases. It weakens our immune system when it's low, and it helps us when it's at appropriate levels. We also know that it helps regulate autoimmune diseases like lupus and rheumatoid arthritis and thyroid disease, and that extends into our other inflammatory conditions like eczema and psoriasis and things that are very common in Western countries. So why is it important in Western countries? Why is it that we see these rise in conditions that are affected by vitamin D? Well, we wear clothes and we stay inside, and vitamin D is normally produced by your skin when it's exposed to the sun. There's a reason ancient cultures really worshipped the sun, is because it does actually have positive effects to your body. And if you're in midday sun in the summer in a bathing suit, it can only take 5 to 10 minutes in a fair-skinned person and maybe 30 minutes in a dark-skinned person to create the vitamin D you need in a day. But even if you live in a sunny area, you may not go outside in the middle of the day that much. And you need to be out in that midday sun when your shadow is short to really get that sun. And in northern areas of our country, there's entire several months of the year that you don't even produce vitamin D because the sun is not at its highest peak. And then when you add that you live in a cloudy city like Columbus, Ohio, we are the 7th cloudiest city in the country, then we have much lower levels of vitamin D when you monitor our population. So what about the RDA? The RDA says you need 400 international units or up to 800 international units depending on what you are as an adult. But that really doesn't reflect this lack of sun exposure. If you draw blood levels of people who live in northern areas, they almost universally have levels below the goal of 40 micrograms in your blood. So what do we need to do about that? Well, what about your diet? I mean, people always ask me, like, can I get it in milk? Milk is interesting because we started to understand how important vitamin D was, so our government regulated that we actually add synthetic vitamin D to milk. It doesn't naturally occur in milk, but we didn't really add enough. So even if you drink 3 glasses a day, you're only getting a little over 300 international units of vitamin D in that milk. So you can see real quickly here that we're just not getting enough, even if we drink it in our vitamin D milk. So how much do we need? Well, infants need about 1,000 international units when they live in cloudy areas. Young children need about 2,000 international units, and adults need between 5,000 and 10,000 to get their numbers up over that 40 range. What do we have available? How do we do that? What's our best way to give that to our families and ourselves to help us get through those winter months? Well, we have the simplest, most inexpensive way of giving vitamin D is actually in drops. So we have drops that are 1,000 and drops that are 400. These can go in anything. They almost taste like nothing, and they're actually just 1 drop per dose, so they're a very small volume. Some of my families just drop them on their tongue. Others put them in juice. It doesn't really matter. You can deliver it any way you want. We also have capsules and little gel caps. These are 5,000, so they're great for adults. These are little gel caps. They're 1,000. A lot of my school-age kids like those because they're easy to swallow, or they even can bite them and have it come out in their mouth. Sometimes we give vitamin D combined with other important vitamins like omega-3 fatty acids. So these are 2 products we have that do that, either liquid omega-3 fatty acid with vitamin D or capsules. And both of these provide us both that important omega-3 and your vitamin D for the day. These are my favorite product. I saved them for last. These are vitamin D gummies by Nordic Naturals. My kids refer to these as vitamin dessert. And so they take their other vitamins that they maybe don't like as much, and I put their vitamin D gummies on the top. And that makes it easier to get them to take their vitamins each day. And remember, the best vitamins are the ones your kids actually take. If you have any questions about what you need for your family, doses, ways that you can deliver them to your family, give us a call at purelyintegrative.com. Thanks.